All right. This is the Man Up Podcast, the doctor's guide to men's health. Each week on our podcast, we interview the top specialists of the field on various topics in men's health. You have questions that you are too afraid to ask, we have the answers. This week, our episode is titled Erectile Dysfunction in Young Men, Why Being Unable to Keep It Up is on the Rise. I'm Dr. Kevin True, and I'm joined as always with my co-host, Dr. Justin Dubin. Justin, start off this show.
Hey Kev, how you doing? Had a great weekend. Actually went to the Bears game today,
Nice.
which was really fun.
Soldier Field.
Soldier Field, beautiful stadium. But we're not here to talk football. We're here to talk about erections in young men. So really, as most people would assume, erectile dysfunction is one of the most, if not the most common sexual dysfunction issue that men are having, and is one of the more common reasons that people come to see us and men come to see us. Typically, erectile dysfunction gets more prevalent as you get older. However, the rates for erectile dysfunction in younger men have really been on the rise. One study finding that men between the ages of 18 to 40 years old, almost as high as 30% of men in this group are suffering with erectile dysfunction. And I think in line with that, you're seeing this increase in something called direct-to-consumer online medical platforms. You think of Roman,
Right.
You think of Blue Chew.
Yeah.
You've seen them. We've all seen them. I know people
Heard
who
the
use
ads.
them.
Yeah.
Exactly. And they have been really on the rise, and the most popular health issue for treatment that these DTCs, as we call them, is for erectile dysfunction. But they also treat hair loss, and they're going and doing infertility stuff too. And the popularity of these is skyrocketing. Really, from 2017 to 2019, there was a 1,500% increase in online visits to these platforms that are treating erectile dysfunction. And in the last quarter of 2019 alone, over 11 million people were going to these websites and using them to get treatment for erectile dysfunction. So obviously, this is a huge issue that we are seeing. And, we're seeing a lot of younger men come in complaining of erectile dysfunction. Some aren't coming to us. They're going to these direct-to-consumer markets, and they're using them. So I think this topic today of really why men are having erectile dysfunction is important. And it's something that really, a topic that we often have a lot with our patients, right, Kevin? And you've seen a lot, and I know I've seen a lot. And Dr. Bennett, as we get into it, obviously he's going to be telling us a lot about it today.
Yeah, I think you touched right, you hit it right in the nail, just in terms of, something that I want to share that we observe for our listeners, like in a urology office in the waiting room. I think everyone pictures it's a bunch of older guys there for their prostate checkups, for their voiding dysfunction, and for their ED. But in actuality, there is a good proportion of patients who are of younger age, and they come there, and a lot of it is to come see us for ED. So, I want our listeners to know that's a totally normal thing. And, our patients are worried. They're concerned, and rightfully so.
Yeah, so let's get into it. We're just really lucky and fortunate to have Dr. Nelson Bennett, who's one of my mentors here at Northwestern. He's a urologist there, specializes in sexual medicine, and I'm learning a lot from him. And we're honored to have him on. So thanks for coming on, Dr. Bennett.
Oh yeah, thanks guys. Justin, you're too kind, and Kevin, it's good to see you again. It's an honor to be on the Man Up program, which is what we're going to do. We're going to man up.
I think it's going to be a great episode.
I agree. We're going to man up and talk about all the things that most men don't want to talk about. That's why we're here, right? So let's get right into it. Like, let's start off with the big question. Why is erectile dysfunction in younger men really becoming more common? Or was it always here? Is it something no one wanted to talk about? But why are we seeing this increase in erectile dysfunction?
I think there's a lot of reasons. I think part of it is, people didn't really talk about it before. Now people are aware that there's erectile dysfunction. They are comfortable talking about it with their partner or their parents or their whatever. So there's more awareness out there. But also young guys, when and I was a young guy once. You guys are still young.
You're pretty young. You're pretty young still.
You look
with a
good.
lot of stress, right? We deal with a lot of stress. We deal with stress at work. We deal with stress at home, stress in the bedroom. So all that stuff can kind of just filter into the bedroom and, wreck your erections, essentially. And then young guys, we sometimes drink too much, sometimes smoke too much. So that's a big thing. And then patients are overweight. I don't know if you've seen a lot of guys come in, but they're a little overweight, a little chubby. And some of that can contribute. Yeah, so, there's a lot of different reasons.
So that's great. I think right off the bat, you touched on some things already of potential causes of ED. You touched about stress, talked about alcohol, talked about diet. Are there any other potential causes of ED, young men, or are these the main ones that patients should be aware of?
These are the main ones that a young guy, when I say young, under 40, that's what I'm going to define as young. Young guy under 40 will have. Yeah.
Gotcha.
Okay. It's not common for these guys to have high blood pressure, cardiovascular issues, previous strokes. May have some diabetes in some select people, but it's not all that common.
All right. So a lot of people come in and they're like, I have erectile dysfunction. I'm worried about my health. We touched on it a bit, diabetes, potentially overweight. So those are kinds of the things that we would counsel patients on, right? I mean, a guy comes in, he's obviously has these problems. Most of the time in younger people, it's not because of heart problems or anything like that. So we do find reassurance, but yeah, I guess there is some overweight aspect to it, right? I mean, being out of shape, eating crappy, no matter what age you're at, is not going to help you with your erections. Is that a fair statement?
That is a fair statement. And guess what happens if you don't have a good erection at one night? That's what you're thinking about the next time.
Exactly. It's a very cyclical process, right? And that's what we see with our young people. Kevin, you mentioned it kind of before, these young guys are coming in and they had too much to drink one night. They can't get it up. And what happens the next time? They're in their heads. They're freaking out and they may be sober the next time. And I think that
builds and it just
and the anxiety gets the best of you. And the mind is a very, very powerful thing that people don't realize, and I think that they do come in worried that they have some health issue. And obviously sometimes in some situations it's possible. We're not saying it's not, but a lot of the times, it's in your head. Maybe you were doing something that, you're drinking too much or whatever.
So Justin, on that point where you talk about in your head, I think this would be a good question for Dr. Bennett. In the current, times that we live in, pornography is a little bit more easily obtainable. So do you think pornography has a role in ED in this population subset?
Absolutely. I think it does. It does. Porn 25, 30 years ago was, I get a Playboy magazine out of my dad's drawer. or if you're lucky, you find a VHS tape that you can watch.
Don't forget the Showtime scramble.
The scramble did.
Yeah. People don't know that.
But now, one click of a computer, you can see whatever sexual, whatever you want.
HD, no more scramble.
There. And it becomes a problem because if these guys, if they're masturbating 2, 3, 4, 5 times in a week, when they have vaginal sex or anal sex, it doesn't feel the same. Even oral sex doesn't feel the same as their own hand. So then they can't keep it up. They have to constantly stimulate. And in their own brain, like, I've got ED. And really, you're just being sensitized to pornography more than not.
Okay. Now, but that's not for everyone, right? Like, that's not inherently everyone.
No, of course
correct?
Not.
Right. So, like, porn can, I think the one thing is, like, porn obviously can also be very helpful for getting erections in some populations. But I do think that there is this aspect of, a lot of people are just always blaming porn. And I don't know if that's inherently 100%, but I agree. Like, people are overstimulating in many ways. And then sometimes there is a level of too much is too much, right? Everything in moderation is kind of that idea. Mm-hmm. Would you agree with that?
I would agree with that, but I also want to bring up another point that I've been seeing a lot of in the past few months. Actually, young guys coming in saying they have ED, but not really understanding what ED is. What I mean by that is they come in, they say, "Doc, I've got ED." And once you drill down and ask them those specific questions, it turns out that they were once able to have sex 2 or 3 times in a day. Now they can't. But they're getting older, so their sexual response is changing. They think they have ED. They're just normal.
Right. They just don't have the refractory time of a 18-year-old man anymore. Doctor, I can't have sex 4 times in one night anymore. I have erectile dysfunction. Yes, I've been in the room with you when we've had patients do that. And is there any, just honest, people will come in. Is there anything they can do to get that refractory time better, or is it, you're just age is gonna get the best of you in the end?
I can tell you that PDE5 inhibitors will decrease the refractory time.
There you go. There you go. So we can help you with that. We can still help you with that. So that's good to know.
I mean, that's interesting though, right? That's like, it's like an expectation that's leading to almost a new definition of ED, because, the patients are expecting to still have the, 18-year-old stamina and, so. I
mean, listen, it makes sense, right? If you don't have the stamina of an 18-year-old in other aspects of your life, you really shouldn't expect it to be going the same way when you're having sex, right?
Exactly.
So, all right, let's see. But when we do see patients with ED, I guess the real question is, because who should be seeing us? Who should be worried, or who should come see a urologist for their ED professionally? When is it time? What's the trigger that you think it's time to come talk to someone?
I think it's time when you think you have a problem and you're turning to the internet for advice or support. Another reason people come in is they've tried some of these PDE5 inhibitors. They've tried the Viagra, the Cialis, maybe from a friend, maybe from an online source, and it didn't work, or didn't work out well for them. Then they should definitely come in and see someone.
So what are your thoughts on, just as Justin mentioned in the intro, of all these direct-to-consumer sites, Roman, Blue Chew, Hims? Do you think these are good, or do you think that maybe that they're kind of leaving out the necessity of seeing a urologist in person to be able to talk to them straight directly?
Yeah, I think they're both good, and I also think they're both bad. They're very new on the market, and they're still getting this regulatory things ironed out. But what I've seen it do is it kind of takes these young guys, and it provides them with basically a how can I say this? A primary care experience. So imagine you're 25, the last doctor you saw was a pediatrician, you think your hair is falling out, you're not going to call your pediatrician and ask for
right.
Pick up the phone and call Hims or Roman. Same thing with erection. So it's taking the primary care out of the equation on some level. When those things don't work, then they should go see a professional like a urologist. But that's my. Now, interestingly, a couple of years ago, I actually signed up for Hims. I wanted to test to see what it was all about. So I made a fake profile. I answered their questions. Waited for a physician to call me. And they never really did. Then they sent me a bunch of free Viagra. Yeah, I got what I wanted, but if I had a serious medical issue, I might have been pretty.
Right, and there is some data, that shows that you are potentially missing. There is no exam, so there is some things. Seeing a doctor at least once in person is going to help out. There's things that you may also be able to help diagnose incidental findings that may be needed or may be important, may not. And then there was actually we had an AUA, our annual urology conference. There was a very interesting abstract that was presented about how Hims and Roman and all these places, although they are convenient, they are actually more expensive, the medications, than coming to us, seeing us, and going through something like GoodRx. GoodRx, and when we use those kinds of prescriptions, you're paying maybe $15 a month, which is a lot cheaper than, I think it was 50 plus sometimes at least. And so, there is some monetary value to the patient in theory in coming to see us as well for these medications.
But I think that touches upon the whole idea that for some of these patients, they may be afraid of coming in directly into the office to see a urologist, and that the convenience of this kind of having that kind of space between is something that they may want to pay a premium for. So that's why I hope this episode kind of helps like normalize this, show that it's okay, come into the urologist's office, we're here to help.
Yeah, I do think it has helped normalize it, and for better or worse, these directed to consumer things.
Yeah.
Like I've seen a lot of men. I don't know if they told us because we're urologists. Like I've seen like younger men just not in the hospital be like, oh yeah, I use like Romans, I use Blue Chew all the time. I use Viagra, I use Cialis. So I think it has helped normalize it to some degree, but yeah, it's still something that people don't like to talk about. And that's why we're here today, for sure. So I guess the next question is like, and we've kind of been hammering on it really, like the treatment approach for ED in these younger men. When we're talking about these guys who really probably don't have these health issues, and it's more of an anxiety-based thing, how do we fix that? How do our patients overcome that issue that they're having with their erectile dysfunction?
Yeah, if they have like, I don't even like the word psychologically based ED because it's a bad omen on the patient. I like saying confidence-based ED, right? So, if the way to fix that is to get a great erection, to rock your partner's world a few times, and then back, it's all good. So you need to use whatever you need to use to get there, whether that's Viagra, Cialis, any of the other aids, maybe you need to prep with some porn, whatever you need to do to get there, you get there. But once you get that confidence back, it's almost like this entire erectile issue just kind of falls off the radar screen.
I like that. I agree. One of the things a lot of patients ask me, so I want to ask you, Dr. Bennett, are there ways to prevent ED? They're thinking this is like a disease process. So they keep asking, are there a way to prevent ED, especially in my age when I'm younger?
When I was in training, Erwin Goldstein told me, what's good for your heart is good for your penis. So if you think like that, you think like a cardiologist, you're going to have great erections for the rest of your life. That's eat right, sleep enough, low stress lifestyle, moderation on alcohol, drugs, etc. What's good for your heart is good for your penis.
It's a beautiful way of summing that up, because just try to be healthy, and then your sex life is going to be around with you later on in life, hopefully, Okay. And some things that we've dealt with, or I've always seen, sometimes partners will come in and talk about it with the patient, and there's this issue with some young men sometimes acting out in situations when they have their erectile dysfunction to their partner, right? And there's this concern of almost like partner blame, where inherently we know, obviously things can happen in a relationship that can get you out of sync with your partner, but there is this aspect of acting out or blame that has become, I think, an issue in the younger population. I know a lot of women have expressed concerns that sometimes a partner has blamed them for their erections loss. It can affect their confidence as well. So how do you counsel young men in a situation where they do lose their erections? How do they react in that? Like, how to react in that moment to kind of, because like obviously that can get you in a funk also. The reaction.
Yeah, and when you're having sexual intercourse, you want things to be harmonious. So if you're thinking, your partner caused your ED or said something or did something, then of course you may want to blame them. But when it comes all back down to it, the household has to be pretty harmonious. A lot of men, I won't say that. Some men will blame women for their erections, but it's really a deflection. Okay. I've never actually had a patient whose partner broke up with them because they didn't have good erections. Maybe because they act like an asshole because they didn't have good erections.
Right.
Not solely because
acting out.
So it's important to have them separate those two things out. All right. And also, sometimes when a man can't get a great erection, the partner is kind of condescending about it.
Absolutely. That's a great point. It goes both ways.
It up. What's wrong with you? And that just adds fuel to the fire. That's just like more anxiety, more stress, and that's not going to work at that point. So you have to counseling. Counseling is probably the best thing.
So do you think? I think that's where, I think if that's one of the hinge points for these couples, sex therapy, couples therapy could really help out in that situation.
Yeah.
Yeah, no, I just as like I did a study. I just finished up, published a study where we looked at the role of male blame in erectile dysfunction on their female partners, and we asked 13,000 women how blame, whether they experienced it and how it made them feel. And what was really interesting is, first off, 79% of women had experienced a male partner losing their erection. So it is a common thing. It can happen a one-off time, but 79%, almost 80%.
Yeah.
Yeah. But what's more concerning is 1 out of 7 women had experienced being blamed by their partner for loss of their erection. And, women older than 40 experienced both blame and ED with their partner more, but it was very common in women under 40 as well. And what was really worrisome about it was that, the women who were blamed for their partner's ED were more likely to end a sexual encounter, which is pretty obvious. They felt stronger sense of responsibility and worry. They were less sexually satisfied. And, they were more likely to end relationships due to their partner's ED. So, obviously how you react, and this goes, obviously we're talking in the study, it was about how the man reacted to their own erections loss, but how the woman also reacts to the man losing their erections goes a long way in actually the relationship and sexual satisfaction. And one thing I think that is important that, even though you lose your erection, that doesn't mean that the sexual event has to end. Right? Like, just because you can't use your erection, you can still, maybe get back into it. Maybe you're doing oral, maybe you're doing some hand stuff, maybe just petting. There's other things you can do than use your penis to at least get your partner have a satisfied event. Thoughts, guys?
Yeah, I agree with you, man. I completely agree. That's a good study that you did there.
Sex is not just penetration.
Right. Exactly. I don't know. I think that's kind of it. Kevin, you got any other questions or comments?
I think one last thing, if we could just have Dr. Bennett expand on, just for our listeners, just the right way if you're taking Viagra. Are there specific ways that you're supposed to take Viagra versus taking Cialis in terms of maybe foods and stuff like that?
Great question. If I see 25 patients in a day, 15 of them are taking Viagra or Cialis incorrectly. It's just perpetuated by non-urologists out there. The best way to take Viagra is 2 hours before sex on an empty stomach. What that translates to in real life is, if you want to get lucky on Friday night, take it around 5 o'clock. Your stomach's pretty empty by then. Work your mojo, have whatever you want to eat, whatever you want to drink, and by 7, you're good to go. Cialis is a little bit different. Cialis, you have to take 4 hours ahead of time. Food, alcohol, all that stuff is not important whatsoever, but you have to take it 4 hours ahead of time. Yeah, if you take it sooner, well, you'll get some effect of the medication, but you want that maximal effect.
And that's important. That was a great question. And that's really important, because you're right. People come in, they say, hey, I took a Viagra 30 minutes and then I went to go have sex and I can't get it up. I'm like, no one's going to be able to get it up with a Viagra. It's not working.
It's surf and turf for dinner and a bottle of water.
Yeah, exactly.
Right? Exactly. Yeah. It's like, that thing's not touching you till tomorrow. Yeah. Then your morning sex. If you want to have morning sex, go for it. But no, that was a great question and a great point. Yeah, because, using the medication is great, but if you're not using it correctly, what's the point?
Exactly.
Awesome. So once again, Dr. Bennett, I want to thank you so much for coming on. This was really great. We learned a lot, and I think our listeners are really going to benefit from hearing it from a specialist like you. So thanks again to all our listeners. Appreciate you guys listening as always. Feel free to download, subscribe. You can find our podcast on all podcasting platforms, including Spotify, iTunes. We always appreciate a review and a rating of 5 stars. We're also now actually on TikTok just for videos and education. So if you want to find us on TikTok to kind of just see this, yeah, we have it, and we have our videos so you can actually see us while we're talking. That's also great and always appreciated. For Kevin and myself and Dr. Bennett, thanks for listening. Until next time, have a good one.